Joining me in the studio is Joel Fagerstrom. He's the Chief Operating Officer and Executive Vice President at St. Luke's University Health Network. Joel, thanks for being here.
Thank you.
Congratulations. This is so exciting. You've got the 7th hospital in the network just built in Monroe County. Tell me a little bit about the facility, where it was built, what's involved, and what's up there for people.
Yeah, it's a very exciting project for us. As you mentioned, it was the 7th hospital we've built, the 2nd new one in the last 5 years, and we spent the last number of months in design and construction, and we opened it up this past October, and pleased to say that we had projected a certain amount of inpatient emergency department visits, and we've more than doubled that. So,
wow, that's incredible.
Yeah, the community has really welcomed us with open arms as we go out and speak to members in the community. They are so happy that we're there and they have an option for the healthcare in that community.
And it's really a beautiful facility as well. How long has St. Luke's been involved in Monroe County? Was the hospital brand new, or was there a relationship prior?
So we've been providing services in Monroe County for well over 20 years, and we provide a lot of outpatient services, and as we continued to grow and expand and align with more and more physicians, it was actually the physicians that asked us to start an inpatient hospital up there, and the citizens of Monroe County have welcomed us.
They must have felt there was really a strong need.
Yes,
if
very
it
much
came
so.
From the doctors.
And, obviously that need has been fulfilled because our volumes are really incredible.
It is amazing to see that there have been 2 new hospitals built within St. Luke's system, and now there are a total of 7 within the network. How does that work in your capacity as the Chief Operating Officer? What are some of your roles and responsibilities to make sure and ensure that the communication and all the plans are executed properly among 7 different hospitals?
So it's not an easy thing to do, but we have our main acute care hospital in Bethlehem, and then we have smaller and medium-sized hospitals throughout the region, and we try to make sure that we provide as many services as we can in the local community. So, for instance, our smaller and medium-sized hospitals, if they weren't part of the network, they would not have the specialists that we've been able to bring there, and a lot of the services, both outpatient and inpatient. Our patients really enjoy that because they can get most of their services close to home, and if they need to go for higher end care, they can come to Bethlehem or Allentown or Anderson campus to get those services.
It is nice to know that there's such localized care within a larger network, but what about regionally? How do you provide regional care, and how do you decide what stays local and what maybe has to be cared for in a different way more regionally?
So let me give you a good example. So we have what we call the Regional Breast Center. And we decided that we would bring our physician experts, our technical experts to one location and provide the best breast health we could provide for the community. And so we brought all those resources to one location. It's really been, I think, a great service for women in the community. And my mom had breast cancer twice. And the most difficult time for her was the time from which she had her biopsy until she found out she had cancer. Both times. And it was very, very difficult. And it was a number of days before she got that answer. And one of the great things that we've been able to do at the Regional Breast Center is we've been able to shrink that time down to a very short period of time, probably you compare best to some of the best in the country. So very proud of the fact that we've been able to provide those kinds of services.
And a great example how having regionalized care is sometimes preferred over local, and how great St. Luke's can offer both.
Yes, yeah, it's worked out very well.
Well, 7 hospitals, 10,000 employees. What's next for St. Luke's University Health Network? What can we expect to find? And how do you maintain that St. Luke's culture and feel throughout this big network?
So a lot of good things happening at St. Luke's. I'm excited for the future. We'll continue to expand our services, both inpatient, outpatient. One of the things we've been concentrating on for a long time, it's part of our mission, and that is to make services easy to access. So we've done a number of things over the last year or 2 to really expand services and make it easy for people to get access to us. So we have a number of urgent care centers. We have 8 right now, and we plan to more than double our urgent care centers over the next couple of years. All of our primary care and specialty offices now have evening and weekend hours to make it easy for folks who might be working during the day and can't get to the physician's office. We have a phone app, which I love. I've used a number of times, called St. Luke's Care Anywhere. And it's a way to get access to primary care physicians 24 hours a day using your phone, your computer, your iPad, and it's been very successful. So a lot of things like that we've been working on to really make it easier for patients to get access to us.
Well, it's pretty amazing. There's no excuse not to get checked out by a doctor if you
That's
need
right.
one. Excellent. Joel, thank you so much for being here. I appreciate it.
Thank you.
For more information on St. Luke's University Health Network or anything from today's show, go to our website at thepeaktv.com. Thanks for joining us, and remember, every day is an opportunity to be your best self. This is The Peak.